Right on, guys. It's been a while since my last video. Things have progressed. Those who are following my videos will know I got quite a complex set of symptoms and issues, which I've had a number of tests for, which are in my previous videos. So just a bit of an update as how things are going. So my last video was my experience on intermittent self-catheterization, which I know that I had a bit of discomfort that week. Carrying on into the following weeks, ended up being absolutely bloody miserable. Um, the discomfort continued to get worse in the days after my self-catheterization training, resulting in becoming harder to pee to the point on the Thursday evening I ended up having to cath once. Lucky they sent me home with some catheters, really. And managed to clear things a little bit. Run 111, usual crap. I'll speak to your GP, blah, 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 blah. I dropped her. No, spoke to the GP, I think, the following day. And again, not. I think I dropped a urine sample out. Was that right? Urine sample? I think I may have dropped the urine sample out to the doctors. See whether I had an infection or not. Um, was it previously? I can't remember. I think I may have dropped the urine sample out to the doctors, and the doctor rang me later on in the day. So I've tested it. I tested it at home. I have my own test strips. I would recommend this people pack on Amazon 10-way urine test strips. It's all pretty idiot proof, really. If you've got leukocytes or protein in your urine, likely you have got an infection. I was showing leukocytes, which people that I see can show up white blood cells and not have an infection, but it was an indication something wasn't right. The doctor said, "Oh, we'll send it off for urine culture." I think he upped my sulfenacin from 5 mils to 10 mils. I was on 5 mils at the time, and see what happens, basically. So I went into the second week. I was feeling a little bit better. Start of the second week, and then I think it was middle of the second week, later part of the second week. I woke up early one morning. Oh, my shaft was killing me, pain. I never felt nothing like it, and I got up because I couldn't sleep. And you're sort of sitting there on the sofa, cupping everything, and thinking, I can't bear this. So I took a lot of ibuprofen and paracetamol, and it did settle down a little bit. I think I might have dropped another urine sample out to the doctor, in trying to see the doctor, and the doctor said, "Oh, we'll bring you back." At which point the pain had eased somewhat. It was still there, but it had eased somewhat. Um, and I think I'd sent her panicked email across to my urologist, Mr. Hodgson, about what's going on, what could this be, sort of thing, and what do I do? Guy's feeling pretty miserable, pretty miserable. The doctor said, "Oh, we can't really do anything until Mr. Hodgson comes back." So I think this went on. I think at the end of the third week, another doctor run me back. So we've had your urine culture back, and you have got a bacterial infection. Brilliant, absolutely brilliant. They prescribed me some antibiotic I can't remember the name of, and I said, "Oh, that's all right." As it was, I was feeling much better. I said, "Oh, that's all right. I'll pick it up Monday." Well, Saturday morning, it was absolutely horrific to the point I couldn't leave the house. The urgency and the feeling needing to pay, pressure, etc. So I lucky I managed to find on my doctor system what they prescribed me. So you get on the 111. Oh, can you prescribe this antibiotic for me? And all the faffing around. They did eventually put this prescription through to my local pharmacy, and I picked it up and went on with that for a week before it finally cleared. But I had about 4 weeks that were about as miserable as I've been really the whole way through this best part of 2 years. And I thought if life's going to be like this, I don't want to go on living. It was really that bad. I think to a point, it's lucky. I'm lucky I got my wife, really, because there were a few times there I thought if life's going to be like this, I don't want to be here anymore. Um, yeah, it was pretty sad, pretty miserable. But the infection cleared up, and with September was a solid finish, and I thought, oh, actually, things have settled down again. So I did the new bladder diary for Mr. Hodgson as requested from my rigid cystoscopy back there beginning of October, and I had a NHS appointment to see him, no, telephone appointment to see him beginning of January. And I thought, oh, I don't really want to wait that long, really. I'd already, after my rigid cystoscopy, I'd already sort of made my mind up. I don't really want Botox, and I think surgery is the way I want to be heading. Really, no, others may disagree with this, but this is how I wanted to go forward. So I went back and saw Mr. Hodgson at the Duchy Hospital there beginning of December, and I said, look, not being funny, no, the flow is crap, the capacity is crap, no, hydrodistension hasn't done a lot. The solifenacin made a big difference to stabilise me even in the cold weather. And I said, look, I really don't want Botox. Now, at the end of the day, worst case scenario, I've got to go into retention, got a cath as often a day as what I'm peeing, which I think based on my bladder diary was 10 to 12 times a day. And I said, look, all it's going to do is make life more miserable than what it is at the moment. So he agreed to refer me up to a chap called Professor Hashim up in Bristol. He operates mainly out of Bristol, at Southmead Hospital. This was on a private basis. I would have gone and seen him at Spire. I did end up having a video call with him. I think, well, he was based in London, I think. And he's basically one of the top pelvic reconstruction surgeons in the country, and I think he's one of the leading urologists in the world. He's a very clever chap, very specialist. So I had a video call with Mr. Hashim. When was that? 7th of January, and basically discuss how I am and how things were going, and said, look, no, I like to go down the augmentation route, and I'd read everything online. You can read about bladder augmentation, everything that's there, and what they do not tell you, which Mr. Hashim rightly pointed out to me, is that it does not eradicate sensory urgency, which unfortunately I do have. This is partly why I can't hold more than about 200 mils of my bladder. It's partly because of the rigidness of my bladder. I get the sensory urgency, and he basically turned around and said, we've got to eradicate this sensory urgency, otherwise I can't have the augmentation. As simple as that. And I think he'd had a couple of male patients. It seems to be more common in male patients. I don't think even he knows why. Where he's had done augmentations, and a few months down the line, no, you've got 800 mil capacity bladder. They can't still hold more than 200 mils, and you're back in surgery again, having everything ripped out, and something more drastic sorted, so you can, be symptom free basically. So I thought, well, I don't really want to go down that route. I sooner stay as I am and have major surgery and end up really in a worse situation than what I am now, basically. So as far as when I went back to see Mr. Hodgson at the beginning of December, I said, look, what is my diagnosis? What has happened? Basically, they don't know. It's simple as that. I'm basically deemed as having a poorly compliant, stable, low capacity bladder with indications of interstitial and radiation cystitis. The I had biopsy showed mild inflammation, which indicate interstitial cystitis. The rigidness is that common of radiation cystitis. Say if you have radiotherapy for bladder cancer, prostate cancer, um, womb cancer, anything like that, where you're having radiation in the lower part of your pelvis. I've never been in close, I've never had radiation therapy or been in close encounter with a radioactive material either. But this is what the bladder indicates really. But they got no idea what suddenly caused it. It could have been assumption would be I had a severe attack of interstitial cystitis there early part of March 2021, but they don't really know. Nobody really knows. But I'm left with a carnage now. That is the long and short of it. Mr. Hashim referred me back to Mr. Hodgson. So basically, I've been asked to try amitriptyline, which is a bit of a nerve blocking medication. Start on 10 mils a day, which could be increased depending on how I cope with the drug and whether it works or not. And I'm going in for Botox injections, which I didn't really want. Unfortunately, I've been backed into a corner as per usual. Basically, you have the Botox, or you got to go on like you are. So I haven't really got a lot of choice now, really. I think, given the fact my flow is deteriorating, even on tamsulosin, I can't up the dosage of tamsulosin because I'm on a maximum dose for bladder problems. So I am really in a shit, basically. I've been booked in for a Botox, which could be any time, maybe up to about 8 weeks away, depending on their NHS schedules. I'm having 100-unit Botox injections. Don't ask me how that equates to how many injections you have. On average, there's about 30 injections into the bladder. I could have had this done under local anaesthetic. Basically, it's like a flexible cystoscopy, but they put large amount of local anaesthetic in your bladder beforehand. The consensus on the bladder pages on Facebook seemed to be have Botox under general anaesthetic. Some people say they can bear it under local anaesthetic. I'm not going to take the risk, to be honest with you. Flexible cystoscopy aggravates me anyway. Um, and I thought I just don't want to take the risk, because if you get there and bottle it, or you get a partway through the procedure and they can't finish it, or you're in tears because you're in pain, I just can't be dealing with it. I tolerate general anaesthetic. It's a bit of a pain because I probably use a rigid scope, which means I'll be sore for a few days and aching up to about 2 weeks. You got 3 days off as opposed to half a day at worst, sort of thing, if you have it done under local. But the main consensus seems to be to have it done under general, so that's what I've opted to have done. So we're going to try the Botox, and 99% sure I'm going to go into retention, because at the moment my flow is that crap. It's only lucky I'm on tamsulosin, really, so I think like it is, I'm going to have to self-catheterize. I'm all geared up, got all my catheters, they've all turned up now, got my little bag of catting kit. So yeah, we're all set, I think, now for what could be the worst case scenario. Got a fingers crossed, really, that between the Botox and the amitriptyline, it works, because if it doesn't, I shan't be having my augmentation. Simple as that, really. And then maybe look, no, if I can't have the augmentation, it's going to be a case of either stay like I am, or maybe end up with a cystectomy with a continent urinary diversion, which might be the last option if I can't have the augmentation. Fingers crossed, fingers crossed. The Botox will eliminate the urgency. There's no guarantee it's going to give me any more capacity, but hope is I won't feel the need to pee. So it would be a quite a bit of an operation to try and work out when I need to pee without putting too much pressure internally on my bladder. Trying to gain a bit more capacity than what I got at the moment. Failing the Botox and the amitriptyline, I have been recommended for ealural installations, which I may or may not have, depends on how Botox works. It's a drug, basically replaces your bladder lining, and those of us with interstitial cystitis, that is where your bladder lining is damaged. But they seem to want to use this as a last resort as opposed to a first resort. They wouldn't. To be honest with you, I would have rather had it as a first resort, because it would have been putting off Botox a little bit longer, but they seem to want to use it as last resort. So I got to trust their judgment at the end of the day. And one of the side effects of amitriptyline is you can end up difficulty peeing as well. So between the amitriptyline and the Botox, I'm really going to have to, cath. I think there's no two ways about it. No, if the augmentation, they're going to have to cath for the rest of my life. At least with the Botox, it is temporary. They reckon it lasts up to about 6 months. It can last less than that. You can't have it any more than every 3 months. But on average, it lasts about 6 months. So it's a long time to be miserable for if it only makes things worse. No, but we're sort of, to a point, really, we've got to know if I want the augmentation, which I think is going to be the long-term plan if the Botox and or the amitriptyline work. It's going to be the way forward. I might do a video after my Botox procedure just to update everyone. And I think that's about it for the minute, really. I'm not sure really there's going to be a happy ending to all this. There's kept thinking, it's going to be light end of the tunnel. Something's going to be done. Something's going to be done. Something's going to be done. And it was a bit of a shame, really, because I was all excited to see Mr. Hashim. Think, I'm going to get accepted for bladder augmentation surgery and get put on the list. And you think time is ticking away down my operation to be told, actually, no, you got more lines of treatment to try first, and it's no guarantee then that you'll have your bladder augmentation. This has knocked me back a bit. No, you get a bit depressed on odd days. No, is when things are quiet, things are fine. When things aren't quiet, life is shit. As simple as that. There is no in between. Life is quite restrictive. Still got to watch what I drink. Still got to watch how much I drink, when I drink. It's just thankful, really. I'm self-employed and I work outside a lot of the time, because if in any other job, I probably would have been laid off as sick, because you just couldn't know. But no, at best I tend to pee about every 2 hours. Worst can be every hour. It depends really on how I'm feeling and what I'm drinking at the end of the day. I think my bladder diary showed only 1.5 litres over the day, so I'm really a good half a litre under what I should be drinking the day before all my problems started. I was knocking back 3 litres a day, even in the winter time. Summertime wasn't the problem. Sweating all the time, knock back the fluids easy. No, it's been better since I've been on solid venison. Things have been more stable. I still wear the thermal leggings, try and help the chill. But yeah, life is far from great, and if I'm not careful, life is still not going to be that great after I've either had the Botox or had the augmentation. At the end of the day, there's going to be no normal. No, life is never going to be normal again. It's a normal ending for me on the 28th of February 2021. That morning when I woke up, that was when normal ended. So yeah, he's not something I would wish on anyone. Really, it's a sad situation to be in, especially at 35. Yeah, so that's about it for the minute, guys. Really, no. Again, any questions, stick them in the comments box. I'll sign off, and I'll do another video again after my Botox injections. Cheers and bye.